So this is only observational data, but actually if we look forward, you can see if you go to clinicaltrials.gov that there is an awful lot of up and coming research looking at CBD in different types of anxiety disorders. So this will all be based on all of this kind of positive background that I've already just explained to you. There's a lot of people out there continuing to research this. So if you look at these, and these are all trials just looking at cannabidiol in anxiety. So it covers a range of conditions, including PTSD, generalized anxiety disorder, anxiety because of breast cancer, anxiety because of alcohol use disorder, anxiety because of Alzheimer's disease. And actually, the most recently registered trial is looking at using CBD in the anxiety caused by COVID. So you can see that there's an awful lot of research in this area. If you look at the patient numbers there on the far right column, you can see that this is using quite reasonably high number of patients in each of these trials. So up to 136, 120, 100 people per trial. So hopefully this data will translate into a greater evidence base for the use of CBD in anxiety disorders, and potentially also some licensed medicines that doctors will be able to prescribe for anxiety disorders, because anxiety is really and PTSD are disorders that aren't very well medicated at the moment. So what is the scientific evidence that that compounds, that cannabinoids are useful in anxiety and PTSD? Well, we do have quite a lot of research in this area, and there's a lot that we know about how these compounds work. Specifically, the mechanisms of action for CBD have been well elucidated. There is a role for the CB1 and the CB2 receptors, particularly in being able to extinguish adverse memories, so being able to forget the bad stuff, and so that's your fear memory processing. Remember that CBD isn't an agonist, doesn't activate the CB1 and CB2 receptors directly, so any actions that it has at CB1 and CB2 to be able to do this are indirect through upregulating endocannabinoids. The other main mechanism that's been shown for reducing anxiety is through activation of the serotonin receptor. There's also a role for the TRPV1, so the ion channel that I mentioned before, which is one of the mechanisms of action of a lot of cannabinoids, and also in that the nuclear receptor called PPAR gamma, and that's mainly in underpinning the anti-inflammatory and antioxidant effects of CBD in the brain that help to improve symptoms in anxiety and PTSD. So there's also lots of evidence that CBD can modulate neurotransmitters in anxiety and PTSD, and in these disorders usually you have some kind of dysfunction of your dopamine and your serotonin transmission. And it can block the formation of fear memories, so stop you from being able to remember bad memories. And CBD isn't the only compound that works, so there is quite good evidence coming out about CBDA, so the acidic version of CBD, the precursor, is also very effective in models of anxiety and is in fact more potent than CBD in these models. Let's move now to depression and mood, and what clinical evidence do we have that cannabis-based medicines can be useful in alleviating these issues? So unfortunately, we have very little data looking specifically at the use of cannabis-based medicines in mood disorders. It's just not an area that has had any kind of clinical research. We do have some indirect evidence, though, that cannabis could be useful in these disorders. So, as I mentioned with anxiety, psychological measures are often measured as secondary endpoints when people have been looking at other indications such as multiple sclerosis or cancer or neuropathic pain. So just to give some examples, a 12-month medicinal cannabis program was found to improve depressive scores in pain patients. So this won't have been the primary objective of the study, but it was one of the secondary findings. It's still valid, but it's not, in terms of weight of clinical evidence, it's not what we would consider to be high quality evidence. It's also been shown that CBD can improve mood in patients with epilepsy and many other disorders. So this is frequently shown with cannabis-based medicines in depression and mood. We do have one randomized controlled trial that specifically looked at depressive symptoms in patients with major depressive disorder. And this is using the molecule palmitoyl ethanolamide, or PEA, which I've already mentioned to you, has been shown to be beneficial in pain disorders, and particularly in inflammatory pain disorders. So this is an endocannabinoid-like molecule, and it was given at 600 milligrams for 6 weeks, and it was found to cause a reduction in depressive symptoms in patients who had major depressive disorder. So this is showing you that giving an endocannabinoid in people who are depressed can improve symptoms. And although we don't have direct evidence that cannabinoids are beneficial in mood disorders, what we do have is the evidence that actually blocking cannabinoid receptors is really detrimental to mood. So there was a medicine on the market which was a CB1 antagonist, so a CB1 receptor blocker called rimonabant, and it was developed as an anti-obesity drug. Because blocking the CB1 receptor does limit your appetite, but also what it also does is just suppress mood. It decreased mood, it decreased people's joy in living, because the CB1 receptor is so important at for maintaining positive well-being. So the drug, which was called rimonabant, was actually withdrawn from the market because it caused major depression, and there were several instances of suicide. So this isn't a very active area of research, and if we look at clinicaltrials.gov, there is just one registered clinical trial that's looking at cannabidiol as an add-on treatment for patients who have bipolar depression, but this is all that's being done at the moment. So what do we know about the endocannabinoid system and depression and mood or stress from our preclinical literature? What does the science tell us about the endocannabinoid system in these areas? Well, actually, we know quite a lot about the fact that the endocannabinoid system seems to be really crucial in stress management. So in animals where the CB1 receptor has been knocked down, so that protein has been deleted or has been blocked pharmacologically, animals can't cope with stress and show signs of depression. So if you don't have the CB1 receptor, you are more likely, or at least if you're an animal, you are more likely to be stressed and depressed. It's been shown that in mild stress, brain levels of the endocannabinoid anandamide increase, and anandamide is the first endocannabinoid that was identified, and pharmacologically it behaves most like THC. So the brain increases levels of anandamide in response to mild stress, and this is thought to be a protective mechanism to activate the CB1 receptor and help alleviate that stress or anxiety. In chronic stress, however, brain levels of endocannabinoids have been found to be decreased. So there is an issue that you have not enough endocannabinoids in chronic stress. And so if you don't have enough endocannabinoids around, you can't have activation of the CB1 receptor, and this means you can't cope with stress and show signs of depression. It's also been found that actually the CB1 receptor itself can become down-regulated, so you have less of the CB1 receptor with chronic stress across the brain. So not only do you not have enough of the endocannabinoids activating the receptor, but you don't have enough of the receptor either. So this all really indicates that the CB1 receptor is really quite crucial in the management of stress and depression. And animal studies have shown that depressive symptoms can be reversed either with CB1 activation, so giving something which is a CB1 agonist like THC, or by inhibiting the metabolism of endocannabinoids. So if you stop them from being broken down, then you increase endocannabinoid tone, and that's been shown to reverse depressive effects. So there's a really crucial role through animal studies for the CB1 receptor in modulating stress. So moving on to sleep, what clinical data do we have that cannabis-based medicines are useful in sleep? And I'm going to talk about each of the different types of products individually. So first, THC products. What do we know about THC in sleep? So we don't have any clinical trials where with THC looking at either insomnia or looking at sleep as the primary endpoint. The data that we have on sleep is all indirect as secondary endpoints in studies. We did, there is a small randomized controlled trial in patients with fibromyalgia who found that THC significantly improved their sleep, and this was better than a traditional sleep medication. So given just before bedtime at either 0.5 or 1 milligrams, THC was significantly able to improve sleep in these pain patients. There's been a small randomized controlled trial in patients with PTSD, and again, using THC up to 3 milligrams, they found that there was a significant reduction in nightmares. This is something that was also seen with CBD, if you remember, in the case series with CBD and PTSD patients. There was a reduction in nightmares also. And several RCTs, randomized controlled trials, investigating THC products have found significant improvement in sleep in patients with lung cancer and diabetic neuropathy and neuropathic pain. And this is again using about 1 to 4 milligrams per day, although always measured as a secondary endpoint. So although THC hasn't been shown to improve sleep in patients where sleep is the only issue, where patients have another problem like a pain disorder or PTSD, THC does have evidence to be able to improve sleep in those patients. So what about cannabis products or whole plant products? So there is quite a lot of clinical trial data with medical cannabis showing an improvement in sleep in patients, but again, not as the primary outcome, but in patients with other problems such as motor disorders or Crohn's disease, medical cannabis products have been shown to cause a significant improvement in sleep. Cannabis use is also associated with greater sleep time in patients with or without HIV. And in many randomized controlled trials with Sativex, and I'm just including Sativex here because it is a combination product, it has THC and CBD and at least 5% of other phytocannabinoids also. So many randomized controlled trials with Sativex across multiple conditions in large patient numbers have shown significant improvements in sleep measured as secondary endpoints. Remember, it's not the primary thing that is being investigated in these trials. So with cannabis products, there is a good improvement in sleep in patients who have other disorders, but it's not been tested specifically in patients with sleep disorders. So what about CBD? There is a number of case reports and case studies that have shown that CBD has positive effects on sleep quality and decreased sleep disturbances in patients with other disorders. So for example, in children with autism spectrum disorder, CBD improved sleep quality. In patients with Parkinson's disease, CBD improved sleep quality and decreased nightmares. And then survey data in patients with insomnia, so with sleep disorders, and there was 409 of these patients did show a positive effect of CBD on sleep quality. Remember, these are all observational, uncontrolled data so far, giving us a good indication that CBD has a beneficial effect on sleep. And there is one randomized controlled trial, and this is actually quite an old study, it's from the 70s, And this was looking at patients specifically who had insomnia. And they found that a dose of 160 milligrams of cannabidiol was effective at improving sleep in these patients in this randomized controlled trial. So this is some controlled evidence that CBD is effective for sleep disorders. There is one registered trial looking at a standard cannabis extract, and this is being carried out by Canopy Health, and this is for patients with insomnia. There's going to be 110 patients in this trial, and to see whether or not cannabis extract is beneficial on initiating sleep and maintaining sleep in these patients. So this is ongoing registered work. So if we look at our hierarchy of evidence triangle, where are we at? What do we know about cannabis-based medicinal products in this range of disorders? So our best quality evidence comes with cannabidiol, specifically in anxiety disorders. We're at the randomized control stage with CBD. There are multiple small controlled randomized trials showing a positive effect of CBD, and there's a lot of ongoing work in this area that's going to move that up the triangle. So we've got fairly good confidence that CBD is effective in anxiety disorders. For everything else, the evidence, the strength of the evidence is lower. It's based on case reports and case series, and it's also based on positive secondary endpoints, which I said they're still valid, but in terms of strength of clinical trial evidence, it's not that strong. And what you would want to do in order to be able to license any of these products for those particular indications is to design a trial where that was the primary endpoint. So we still have some evidence, though, that cannabis, THC, and sleep and CBD all seem to have some positive effect in sleep disorders, and there is some work ongoing pursuing this, at least with a cannabis extract. We have lots of indirect evidence that all types of cannabis-based products seem to be beneficial for depression and mood, but we have no hard evidence, no randomized controlled data to that effect. And we have case reports and anecdotal evidence that CBD could be beneficial in PTSD. And this is an ongoing area of research with registered randomized controlled trials that should increase the strength of that evidence. So using this same table as a summary and as a guide, the cannabis treatment that we have the best evidence for use in anxiety would be cannabidiol, but we do have some evidence of cannabis products or THC, but it's important to maintain the dose of THC low in order not to have any pro-anxiety effects. In mood, we don't have best evidence for any products, but we have some evidence for cannabis and low-dose THC, and probably also CBD actually could go in there, although we have less evidence about CBD and mood. And then for sleep, we have some evidence for CBD, THC, or cannabis. All seem to have some evidence for improving sleep, but we don't have any products with best evidence. So to summarize this data, improvements in quality of life measures such as anxiety, depression, and mood with medical cannabis products, and that's whole plant or purified THC or CBD, have all been observed in randomized controlled data, but always as secondary endpoints. And this is across patients who have multiple medical conditions, but not specifically with just those conditions, so not with actual mood disorders. Few studies have specifically tried to prove these particular indications in relevant patient populations, so not just as a side effect maybe of these products being good analgesics. So could you say that because they're relieving their pain, that's why their anxiety and depression and mood are improved, or is it an independent effect of the cannabis-based products? So that has yet to be proven and needs to be done in specific relevant population who have these psychiatric conditions. The only exception really is for the use of pure CBD in anxiety disorders, which is a very active research area. And I think in the short to medium term future, we will have a lot more clinical evidence about the use of CBD in these areas, including in PTSD.